Hello, dear friends. This is Sofia Dorinskaya, President of the International Bureau for Human Rights in Mental Health and head of the Sofia Dorinskaya Medical Information Center. Today, I want to tell you about an initiative put forward by the Ministry of Health of the Russian Federation. Right now, the Ministry of Health wants to introduce administrative liability into the Code of Administrative Offenses. This is called the Administrative Code for doctors who violate the procedures and rules for providing medical care. On one hand, the initiative seems just wonderful. Indeed, doctors need to be held accountable for incorrect diagnoses, improper treatment, and so on. But let's take a closer look at what the order and quality of medical care really mean. The next initiative proposed by the Ministry of Health is to introduce so-called health managers. A health manager is a separate person, an employee of an insurance company. He is from the insurance company of the Ministry of Health. This health manager will have your personal cell phone number, will know where you live, and will be responsible for certain tasks. He will closely monitor to make sure you don't miss preventive checkups and that you receive all the treatment prescribed by your doctor. What do preventive checkups and the treatment prescribed by your doctor have to do with this? And changes to the Code of Administrative Offenses. Let's recall the changes concern the Code of Administrative Offenses. When a doctor does not, they want to punish doctors for failing to follow the procedures and quality standards of medical care. What medical care procedure is the Ministry of Health currently using? And that means you have to undergo regular preventive checkups, and you have to get vaccinated regularly according to the vaccination schedule set by the Ministry of Health. What is the quality of medical care? This means that the doctor will be required to prescribe you medications that are listed in the standards. And now, more and more unnecessary substances are being added to the standards of medical care, for example, psychoactive substances. So, if you think that the changes to the clinical guidelines will affect the doctor's responsibility, that you were treated and got worse, that's not the case at all. They will look at the documents, your medical record, and they will investigate. So you got sick here and came to the doctor. And before that, you didn't go for preventive checkups and didn't get all the vaccinations that the Ministry of Health decided you should get. And you got sick, and the doctor decided to treat you somehow. And right away, he violates the procedure for providing medical care. If you think I'm making this up, that I'm just sitting here out of nowhere and inventing that this is how it will be. For example, I'm 42 and have no medical record because I never get sick. But time goes on, the body ages, and most likely, someday, I will get sick. Maybe, yes, I will have to go to the doctor. So, can you imagine? I don't have any vaccinations, I haven't had any preventive checkups, and here I come to the doctor. So what does the Minister of Health say? Along with the introduction of insurance principles, we plan to implement monitoring of how the insured person takes care of their health. So they are introducing a health manager. If a person, despite repeated reminders, does not come for a medical checkup and preventive examination, we will take this into account because we are planning additional packages of certain extra guarantees offered to citizens in addition to free health care. So, for example, if I, God forbid, come in with some kind of cancer of some stage, and I need it, here, I will receive some kind of medical assistance. But there will also be some package of guarantees that I won't be able to get because I haven't gone through all of this, which doesn't even relate directly to my illness. And if the doctor decides to prescribe something for me, and there are things here that I need, but he decides to prescribe them, first of all, he won't be able to. And if he does, he'll be punished. Well, at the very least, this health manager, I don't even know according to what laws this is being introduced or on what basis. Some random person will tell me what to do with my body, where to go, and more. In fact, people are being deprived of the right to sole and unconditional ownership, that is, ownership of their own body. Each of us ultimately has control over our own body. Only we have the right to our body. But, so to speak, the Ministry of Health has slightly different opinions on this matter. The minister has a lot to say about this initiative. She says that preventive checkups are very important. And she also says right away that nowadays people are being treated the same way as 50, 60 years ago. I want to say that this is not true, because 50, 60 years ago, there was Soviet medicine that was not influenced by pharmaceutical companies, medicine focused on prevention, medicine focused on disease prevention, which is also confirmed by statistics from the Soviet period. Now, when they started actively changing treatment standards and introducing psychoactive substances, it's no secret that at the beginning of the year, the mortality statistics among the working age population, aged 35, 44, which is the most able-bodied age, it was comparable to the mortality statistics in the rear during World War II. Well, excuse me, but the statistics somehow don't support those words. Next, the minister says that preventive checkups are important. On the one hand, it's hard to disagree, because some diseases really are detected. But here the minister also says that in Soviet times, 50% of those who underwent preventive checkups were actually just made-up numbers. So, in general, does it really matter on a global scale whether a person goes for preventive checkups or not? Well, to be honest, the health of the population doesn't really depend on that much. It's preventive measures and quality care for patients that matter. Indeed, when a doctor in the district keeps track of the entire medical history, even if a person goes to the hospital and comes back, the district therapist sees the whole story, the entire medical history of the person. It's really a kind of supervision, if I can put it that way, of the patient's medical history. The emphasis is on preventive measures. After all, in the Soviet Union, there was a huge network of health resorts. Factories and scientific institutes all had health resorts where employees could improve their health. Various children's institutions, during vacations or for a term, we would go to children's sanatoriums to improve our health. There were wellness activities and different health programs in schools and kindergartens. Remember when we wore special glasses and the lamp shone, signaling ultraviolet light, especially in children's institutions in the north, and, so to speak, beyond the Arctic Circle? Where have our health resorts gone? Where have our preventive children's activities gone? Not just giving shots. Sorry, but vaccinations are not really prevention. Don't you remember, during flu epidemics at school, we all used to wear garlic? Well, excuse me, but that's not like a vaccination, after which half the class doesn't show up the next morning. These are very serious things. And when I see statements like that, honestly, I have to say, that's a violation of all human rights. Now some guy decides what I should do. And I want to tell you, right now they're preparing a change in the law where the doctor stops being the patient's friend. If the doctor sees that you don't need something prescribed, but he is required to prescribe it, and if he doesn't prescribe it, he'll be fined. You know, putting a doctor in such a situation, being an honest, decent person, and constantly being punished for it. Well, I don't think doctors will be able to handle this. They'll just start following the list. They'll start denying someone the medical care they really need, in the amount they need. doctors will start leaving because, well, sorry, that kind of pressure is just impossible to endure when you're always being blamed for everything by everyone. So these changes are really very harmful, both for the patient, for whom the doctor stops being a friend, and for the doctor who statis bo. I'm not sure. He also joins our medical activities, or he's always walking around, making excuses from morning till night, from night till morning. It's a very interesting thing. I saved it, and I'll definitely put a link to my post on Echo of Moscow in the box below, and there will be a photo scan attached there of the patient who was a friend and the doctor. Below, on Echo of Moscow, there will be a photo attached. Scan, 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 scan. Scan, scan. Scan, 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 scan. It's based on some developments by the World Bank. Well, actually, honestly, of course. I can't claim that this is an official document, even though it's been published. The correspondence was basically on the internet. I specifically copied this letter, and I'm posting it. You can judge for yourself if it's true. But what else did I want to say? So, when the president of Russia, Vladimir Vladimirovich Putin, met with the United People's Front, they discussed problems in medicine, and people from the audience stood up and said, "This is wrong, that's wrong," and the president said, "Okay, make suggestions." Well, okay, if this is wrong, suggest how to fix it. Naturally, no one said anything. But look, here's the thing that happens in the West, in America, maybe in Europe. This medical system, which is based on a capitalist idea, on a very serious, frankly, rather nasty capitalist idea of extracting profit from everything, no matter what. And actually, what I see now is that they're trying to make a profit and turn us simply into meat, living meat, from which profit can be extracted in any way possible. Because forcing a person to get vaccinated when they don't want to, or don't think it's right, or to go through some medical checkups, or to consume some pharmaceutical drugs that are prescribed to them. What is this, really? It's like turning on a pump, just extracting money from me as an object of medical and pharmaceutical attention. Yes, I'm just an object. Naturally, this platform is just about pumping money, and it doesn't matter if it helps people or not. It's about extracting money from people, like from living flesh, and from the state. Because believe me, people who pump themselves with all sorts of pills and pharmaceutical products like this, they naturally start to get sick. There are a lot more people becoming disabled, a lot more sick children being born, and so on and so on. This is the social budget. It gets inflated, of course. Part of it goes to pharmaceuticals, part of it goes to doctors. And this is how the system is designed to survive, and to make sure that every single person, by any means, is forced to consume these medical services and pharmaceutical products. And this is a system that has been developed and perfected over decades. This Western system, well, let's say of medicine. What do I want to suggest to scientists and doctors? Do we need to? In order to change this system, we need to build and calculate a healthcare system that will simply be based on a different idea. After all, it's not for nothing that people are saying the world is becoming bipolar again. But what is making it bipolar? Yes, exactly from that. On one end, there's the idea of this blinding capitalism, extracting money no matter what, with a complete lack of any ethical principles. Here's the money, that's it, and everyone's gone crazy? And the second is still common sense, honor, and decency. These are the two polar systems. And what we need is to calculate our health care, to create a financial model based on conscience, honor, and decency. Because don't tell me that an honest person should be poor. That's a false idea that is being drilled into people. And we're being taught that you can only really live well financially if you're a scoundrel. But that's not true. For example, I'm not just saying this. I have actually worked a bit in this field. For example, one of the most severe dependencies right now is when medicine merges with pharmacy, with the pharmaceutical business, and they become so intertwined. And pharmaceutical companies. Well, let's be honest with ourselves. Pharmaceutical companies pay doctors. The profits of pharmaceutical companies are truly fantastic, and they can be comparable to, if not greater than, the profits of illegal drug trafficking. You can't even imagine the kind of profits involved there. Thousands of % in profit from selling certain pills. And now they've merged. What should we do? For example, here in Russia, we need to pass a law that pharmaceutical companies have no right to cooperate with medicine at all. They have absolutely no right. But since they already pay doctors, pharmaceutical companies should be required to make payments. I don't know, maybe 30% or half of their profits every year should go to the Russian Medicine Fund. For example, half of that should definitely be distributed as equal percentages to doctors' salaries. After all, you're already paying doctors anyway. But we need to break this corrupt dependency. We absolutely must separate pharmaceuticals and medicine, otherwise we'll never achieve anything. Pharmaceutical companies should be banned from having sales representatives. They shouldn't be allowed to do that. There are scientific conferences where they present information, but there should be no direct contact. If a pharmaceutical company wants to operate in Russia, it has to invest half of the income it earns in the country into the medical budget, and then the medical budget distributes it. No direct contact allowed. If a pharmaceutical company is found to be involved in these kinds of corrupt connections, the pharmaceutical company must leave the Russian market, and another pharmaceutical company should take its place. There are plenty of these pharmaceutical companies in the world, you know. Well, there are a lot of them, let's put it that way. Yes. So if not the first one, then the second. If not the second, then the third. Next. Right now, the business of pharmaceutical companies, unfortunately, I can't say it's mostly like this, but let's not, so to speak, look at things through rose-colored glasses. Pharmaceutical companies, their business is calculated to include the production of legal drugs. That's exactly why they're now being included in all treatment standards. That's exactly why we get messages saying that a 6-year-old child with signs of autism has already been on antipsychotics for 4 months. Well, they're just destroying the child's brain. You know, that's exactly what capitalism is. No one cares what happens next. Exactly. But pharmaceutical companies can really go wild if we calculate how they'll thrive on the idea of health prevention. For example, let them produce some nutritional supplements that improve one category of patients. Diabetes, insulin-dependent, non-insulin-dependent, elderly people, working adults, children. Some in the northern latitudes, but not in the southern latitudes. Some preventive, safe nutritional supplements, vitamins, maybe some herbal blends, I don't know what exactly. But some kinds of protein substances, yes, because it's no secret that, for example, pensioners, first of all, have a very low income. And to be honest, pensioners are starving. And just imagine if there was an inexpensive protein nutritional supplement, just a powder that you mix with water, that any elderly woman could buy for 100 rubles. And there you go, she would have, so to speak, a supplemental feeding program. She will take this protein supplement and she won't get sick because her body will be getting enough nutrients. So what I mean is, yes, indeed, right now we are doing everything we can to implement this. The American and Western medical system, but we need to understand that this system is built on the idea of greedy profit. We need to understand that the almost universal drugging of Americans, when they start taking antidepressants from a very young age, antidepressants, this is not just a coincidence. This is exactly a business that is built on making a profit, no matter how. But we have to counter this with our financial calculations, which will simply be based on a different intention, an intention to preserve health, an intention to truly have a healthy nation. But to pump it up by any means, any at all, I don't know. Well, I don't know. A health manager, of course. That's already beyond the line, of course. So why don't you assign this manager to every person at home? Let them come in, I don't know, take swabs every day. Well, I don't know. But I think this has already crossed the line. Doctors are constantly bothering poor, unfortunate people. A doctor should treat the sick. Healthy people should live their own lives. You get sick, get treated, and leave. That's how it should be. A person should take responsibility for their own health, but a health manager will never instill responsibility in someone. If I want to be healthy, I take vitamins. I lead an active lifestyle. I eat certain foods. I regulate my work and rest schedule, and so on and so on. But not the health manager. The manager acts. The only thing the health manager does is force me to take, like it or not, this pharmaceutical product. So right now, we've organized a petition. Since this initiative is still being considered by the government, we've organized a petition, and I really ask you to sign this petition and send it to your friends, relatives, and acquaintances. I understand that this is, well, let's say, not an easy thing. You need to read it. I understand that you need to, well, use your head here. It's not something simple. It's not a very simple slogan, but I tried to explain this scheme in a simple enough way. I think this is something understandable. And the second question. So, doctors, economists, mathematicians, guys, let's get together and let's calculate our system, which will be based simply on conscience, simply on honor. And I say it again, it's not true that good people, decent people, honest people are always poor people. That's not true. And I believe that we can absolutely prove this. This was Sofia Dornskaya with you. All the best. Goodbye.